How does brain radiation, for example, impact brain function? I want to put the disclaimer here that cancer-directed therapies such as chemotherapy and radiation are so incredibly important, and I don't want to take anything away from them. I also want to bring to light some of the important considerations and things that happen to brain cells as a result of these treatments. So we have to balance the treatment with the response so that we can understand some of the cognitive related changes that we see throughout the course of treatment. Let's use language, for example. And so language and cognitive function are commonly reported as changed following radiation for patients with both low and high grade gliomas. We know that therapeutic radiation, usually the dose is around 54 to 60 gray, depending on the diagnosis. It yields longer survival for patients. We know that. That is very clear. The beneficial effect of radiation, as I mentioned, has to be balanced against developing late cognitive and functional declines, these consequences of radiation. The mechanisms, the exact way that radiation changes the brain is not completely understood, but we know that radiation influences white matter changes, meaning the strength of the connections that make one part of the brain or one set of neurons fire with another set is lost or is diminished because of radiation. Again, it's an important therapy, but that's a trade-off that has to be thought about and discussed. In addition to these structural changes, there are cells. These are the precursor cells. In this specific example, it's oligodendrocyte precursor cells, or OPCs. They're quite sensitive to radiation, and their ability to make new cells that make that white matter thicker is really diminished as a result of radiation. So it's really important to think about this. But despite this impact, we see fluctuations in cognition over time. While these treatments can negatively influence some of the important cells in the brain, there is repair, and these repair mechanisms can lead to pretty remarkable recovery over time. So here on the right side of the graph here, you can see how cognition changes throughout the course of treatment. And as I'm looking at this, the font's a little small, but you can see if you lose language as a specific example, and the further to the right you go is time, beginning at baseline or initial diagnosis, and this is out to roughly 27 months, you can see here that during the initial period, patients are doing often well. Following surgery, there's an initial drop for most patients. That decline in function improves. That's the post-resection recovery. And then for folks with certain types of disease, that's when radiation comes in. And you start with brain irradiation, and then you get the post-radiation effects towards the latter half of radiation. And then for the majority of folks, that radiation effect improves back to baseline. And you can see that not just for overall task performance, but in a task-specific manner, looking at picture naming and auditory naming and different elements of speech over time. This fluctuation or plasticity response that you see is really tapping into these mechanisms that organically happen in the brain. The key is, how can we tap into them to promote this plasticity response and help it happen faster, more efficiently, and maybe target it for some patients over another?